asthma and COPD heroes. It's Denise, one of the respiratory therapists with Nightingale, with our fourth Nightingale tidbit on fall allergies. In addition to avoiding your fall allergy triggers, consider taking medications to help control symptoms. They can be pills, like over-the-counter pills, or prescription medications. They can be in liquid. They may be in some nasal sprays, or eye drops, or in a cream. Now, I have no affiliation with any pharmaceutical companies, and I will give you the names of some of the more popular medications so you have an idea of which ones belong in which category. So let's get going. And the first category is antihistamines. Those are used to block the histamine chemical reaction that causes sneezing, postnasal drip, nasal congestion, and itchy, swollen eyes. Some of the medicines that do that are your Allegra, your Claritin, your Zizal, your Astelin, your Pantanol eye drops, your Zyrtec. The next category is corticosteroids. Those are your nasal sprays like Flonase and Rhinocort, and they help to get the nasal inflammation or swelling down. Oral prednisone pills or liquid is used for severe allergic reactions, and triamcinolone cream is used for skin reactions such as itchy redness and scales. Anti-leukotrienes, or montelukast, is used to stop the leukotriene chemical reaction that causes nasal swelling, runny nose, and sneezing. Mast cell stabilizers like nasal crom are used to reduce the mild to moderate inflammation by preventing the release of histamine from mast cells. Those are the cells that make and store histamine. They also have anti-inflammatory effects, but typically they are not as effective as steroids as getting that swelling down. Anticholinergic nasal spray like Atrovent is used to reduce a runny nose. And decongestants like Afrin, Sudafed, or combinations like Allegra D or Zyrtec D are for quick, temporary relief of nasal and sinus congestion. There are limitations on the duration, such as not using nasal spray decongestants for more than 3 days, because they can cause rebound, which is an increase in swelling in the nose and may be contraindicated in people with high blood pressure, cardiovascular disease, glaucoma, or hyperthyroid disease. Biologics are the newest category of allergy medications. Those are your Xolair, Dupixent, and they are injections that are used to prevent a specific immune system reaction in asthma and allergies. Talk to your healthcare provider or pharmacist about what medications might be helpful for you and not interact with your other medicines you're already on. So thanks for watching, and bye for now.